You are watching the DocTalk show.
But I'm sure there might be other surgical options available.
Interventions, yes. So in the scenario, which is the majority, where people haven't really had children, they still desire children, they still need their uteruses intact, we have to devise other methods. So we've tried both medical and surgical interventions. The medical ones is really just to alter the hormone levels. Can we try and maybe shrink this mass? Can we try and control the symptoms, the bleeding? Can we stop or control bleeding? Can we control the pain? And so those are more supportive. So plenty of drugs we can use to try and control both bleeding and the pain, and others as well to shrink the masses. However, majority of these medical interventions are not long-term, and they are depressing over time. So they have so many side effects that women cannot withstand for protracted periods of time.
Maybe in a short while we shall understand more about these medical interventions just in a moment. So apart from that surgery process of removing the entire uterus, this what you call hysterectomy, would there be other surgical or other interventions that are available, Dr. Daisy, to deal with that mass without necessarily removing the entire woman's womb?
Like Dr. Mugisha had said, if this woman still wants to have children, or maybe she has one child and she still plans on growing her family, you'd want to consider less invasive techniques. For example, you could do a myomectomy. A myomectomy is surgical removal of just the fibroid.
Of the fibroid alone?
Yes.
Okay.
And it can be, depending on the one, of course, the size and the technique of the surgeon, it can be minimally invasive. So they could do it laparoscopically, or they could do an open abdomen and actually remove the fibroid.
So the surgery option is either remove the entire uterus or just remove the fibroid?
Yes, and then there's also blockage of the blood supply to the fibroid. There is a procedure called uterine artery embolization, where they just put a substance in the artery of the uterus, the uterine artery, which will reduce the blood flow to the fibroid and then cause it to degenerate.
Because it requires the blood supply for its growth. So you're kind of like blocking a small artery going to the fibroid.
You're cutting off its blood supply.
Then you starve it and then it will die on its own.
It will die on its own.
Okay. So Dr. Mugisha, the medical interventions you mentioned, you said these alter the hormone levels. Could you help us understand more about those medical, the medicines that, like if a lady does not want surgery at all, she prefers the medicines, what medicines do you recommend?
Majority of medical interventions, about 60% fail, and these patients end up having surgery ultimately in about 2 years. So it's really a short-time intervention, and that's why we have to have plans, goals. Why are we doing this, and what are we targeting?
They're not so effective, the medicines.
They relieve symptoms. They relieve symptoms for a short duration.
For a short period, but they may not. But you said 60% of the women who have fibroids and are on the medications ultimately will require the surgery.
Will ultimately require surgery, yes.
Okay, so it means they may not work as effective as having the surgery.
Remember, we had earlier said that these fibroids tend to come back. So yes, you will give medication, they will regress, but then when you remove the medication, these tend to come back again.
Okay. So help us, which medicines could be available?
Which medicine? So yes, like we said, we mostly want to reduce the hormone, the food for these fibroids, what really allows them to flourish, what really gives them the media to actually grow. And those are hormones, as we said, both estrogen and progesterone. So we can make use of contraceptive pills, contraceptive medications to try and they help us reduce the hormonal concentrations. So say the pills are good. We can have the injector plans. They are good at reducing both bleeding and also shrinkages of these masses, because they totally suffocate the supply or the media within which these masses can actually can actually grow.
Okay, so that's another benefit of family planning, because
Yes.
not many women will understand how valuable family planning is, but you're saying the hormonal methods of family planning can help prevent or reduce
Can control,
fibroids.
yes.
Okay, and if they don't work, what else can they use, Dr. Days?
There are more complex drugs that you can procure from your gynecologist under their advisement. For example, these GnRH analogs. GnRH is a hormone, okay, that regulates the whole menstrual cycle.
Okay.
So what they tend to do is they give these women these drugs, and it should cause an absence, a complete absence of these estrogens and progesterones, or a reduction in their quantity. And by so doing, again, starving the fibroid. So it
Okay.
will cause shrinkage and possibly degeneration. But the problem is you can't use them for long periods of time because they have very adverse side effects.
Okay.
Okay? So you want to use
So
them.
how long should you use them?
Most people recommend less than 6 months. Okay?
Is that
'Cause
enough time for the fibroids to
the thing is,
reduce?
like Dr. Mugisha said, all these women tend to end up again having surgery because you're treating to manage them for that symptom or the problem they have at the time. But once you remove the medication, they tend to come back.
They tend to come back.
Yes.
So ultimately, surgery seems to be probably the better option in this case. The medicines, yes, will control some of the symptoms, but they may not do it as well. So it is always best, if you have a fibroid, please consult your gynecologist, and they help draft an action plan for you, whether it will be surgery or medical, depending on a number of factors, as we have explored. How can women prevent themselves from getting fibroids? Dr.
Yes.
Mugisha.
When you talk about prevention, means you know the cause. And like we had alluded earlier, this is an enigma in our field. So we also do not know the cause, so it is hard to tell you, do this, don't do this, and therefore you won't get something like this, yes. But we've looked at protective factors, things we feel that lessen the likelihood that you will actually get fibroids, not necessarily in the sense that you will not actually get. So things like physical exercise have been shown to actually either delay or reduce the onset and development of these fibroids. So physical activity is key. A reduction in weight. There's been once in a while you'll get patients who will ask you, what foods do I take? What foods don't I take? As far as reduction of these fibroids is concerned, do I have any restrictions? We are not so restrictive on what you should and what you shouldn't. But we will most likely tell you, you know, this such and such foods like red meat, consumption of a lot of red meat, consumption of a lot of dietary products, vindictive consumption of things like soy foods, soybeans.
So they shouldn't take those foods?
Yeah, those foods are most likely, they have been associated with...
so which foods are safe to prevent fibroids?
Yes. Currently, foods,
vitamins,
you know, we're talking about, you know, green vegetables are good, cabbages are okay, you know, things like broccoli, these fresh garden vegetables.
The vegetables are good, they can help prevent
They help
fibroids.
detoxify the substances that would otherwise foster estrogen progression.
Okay. And Dr. Daisy, would there be any other preventive measures apart from the lifestyle changes?
Use of family planning. Okay,
Family
contraceptives,
planning.
yes,
Okay.
to allow for planning and your body to recover.
They have benefit in preventing fibroids. Okay, so dear viewers, you're again watching the DocTalk show. We thank our guest doctors, Dr. Mugisha and Dr. Musinguzi, for discussing this very common disorder of fibroids in women. We have learned that these are non-cancer growths within the woman's uterus, predominantly driven by hormones, and they tend to affect women in their reproductive age. And we have learned that these conditions can be treated by medicines or with the options of surgery. However, you need to consult your gynecologist when dealing with this condition. They will draft up an appropriate action plan for you. So thank you for watching the DocTalk show, and remember you can send your questions, your comments, your feedback on the social media platforms, and we will respond to them. We thank you for watching again. Have a good night.